DG Eric basically explained naman, it's not a contraindication. They're just giving us a choice of a better vaccine if it is available. But since there is none, 50% is better than zero. And we know that 78% yung protection niya for moderate disease, 100% for severe. It's probably not going to be 100%. There's no 100% naman talaga in real life. There's going to be issues about take and how people respond to the vaccine, but it's going to be fairly high. And because this is an emergency, this is a pandemic, there is a clear and present danger to the healthcare workers. And we've been working at this for the last year. And so even if had there been a different vaccine, that's a theoretical situation. This is now. It's arriving on Sunday. The discussion was, well, if it's not prohibited, at the very least, we should let the healthcare workers first shot at it, if they want it.
Right of first
if they want
refusal.
to wait, then that's fine. But at this point, I think healthcare workers deserve that choice.
Is there unanimity among healthcare workers as to their, being willing to get jabbed with Sinovac? Or are there more of you who would prefer to wait, no matter how indefinitely? What's the pulse?
Well, it's a mix, okay? But ever since, even before this controversy, there were a lot of us who were already saying the first vaccine that arrives, we're going to take it. And we were kind of thrown for a loop because of what FDA said. And now that FDA has clarified, I'm willing to take it. And more than a few people I know are willing to take it. But again, we understand, we recognize that there is hesitancy, and we respect that. And so if you don't want it, you don't lose your place in line. If Pfizer arrives, if Astra arrives, then you are still in front to get it. And so I think that the healthcare workers deserve that choice after the tremendous service that they've given. And the vaccine will not go to waste because it's 600,000 doses. It's about 1.3 million healthcare workers. So you can vaccinate 300,000 to 2 doses. So, we'll just go down the line and see. And there are a lot. I'm pretty sure a lot of people will take this. If not the healthcare workers, then we go down the line. And I think that, as for me, I'm excited. Kanina nga medyo naiiyak na ako when I realized na ito na yung resolution. And, we've been waiting for this for over a year. And every day I go out there, I am scared for my life. Is this the patient that is going to infect me? And finally, there is something that I can do very tangible, aside from the PPE and everything, that I know that it is the start of the end of this nightmare. And that just really got me because I think everyone is sick and tired of this. I just want to get it over with.
Malapit na rin dumating yung di ba? Malapit na rin dumating yung sa COVAX facility. Yun ang iniisip naman ngayon ng mga health workers, maghintay-hintay na lang a couple more weeks.
And that is, and we give them the right of first refusal. Kung gusto nilang sige, total naman, may nagsasabi na, total naman naalagaan ko ang sarili ko in the past year. Yung ganon, sige, maghuntay na muna ako. Sige. And then we go on down the line kung sino ang papayag na, sige na, kailangan ko na. Because remember that this is good for 300,000 people. And tinatayang 1.3, 1.5 million ng health workers natin. Kahit mag-hesitate man o ayaw man pumayag ng iba, meron at merong papayag na aka na. Kung ayaw mo, ako nakasunod sa pila.